Welcome to Facts TV News, where everything is true. Charred remains of PNP political organizer found in St. Ann. The charred remains of a popular St. Ann political organizer was found at his house in Alexandra in the parish on Tuesday morning. The deceased has been identified as Philmont Winter. Preliminary reports are that sometime after 2 a.m., residents saw fire coming from Winter's house. There was prior to residents allegedly hearing the sound of gunshots coming from the premises. The police as well as the fire department were alerted, and upon their arrival, the house was seen ablaze. Following cooling down operations, Winter's charred remains were found. His body was taken to the morgue pending a post-mortem examination. Winter was known for his political organization within the Southwest St. Ann constituency for the People's National Party (PNP). Up to the time of his death, he was an employee of the Office of the Public Defender, according to his Facebook profile. A probe has been launched to establish the cause of the fire and the circumstances surrounding Winter's death. Montego Bay woman charged after 10 million cocaine seizure. A woman has been arrested and charged with breaches under the Dangerous Drug Act after police seized 3 pounds of cocaine at the Songsters International Airport in Montego Bay, St. James on Saturday, March 20. She is 42-year-old Stacey Simit, a data entry clerk of St. Irwin in Montego Bay. Reports are that about 11 a.m., Simit arrived at the airport and attempted to board a JetBlue flight destined to Fort Lauderdale, USA. During security checks, approximately 3 pounds of cocaine was allegedly found in her possession. Simit was subsequently arrested and charged with possession of cocaine, dealing in cocaine, and attempting to export cocaine. The illicit drug reportedly has an estimated street value of US $68,000, Jamaican $9.9 million. She is scheduled to appear before the St. James Parish Court on March 29. Illegal gun seized in Kingston 13. A Smith & Wesson firearm with a magazine containing 10 9mm cartridges was seized during an operation on Crescent Road, Kingston 13 on Sunday. The police report that about 9:30 p.m., cops saw a group of men converging on a premises, and upon their approach, the men ran. A subsequent search of the area led to the seizure of a firearm. No one was arrested in relation to the seizure. 2 men gunned down while sitting in parked car in St. Andrew. 2 men were gunned down by unknown attackers on Fair Lane Drive off Red Hills Road in St. Andrew on Monday. They are Janika Stead, 29, and Sean Shackleton, 21, both of whom are from Beach Road addresses in Bull Bay, St. Thomas. According to police reports, about 6:30 p.m., the men were seated in a parked Toyota Axio when they were pounced on by armed men who shot them several times. They were pronounced dead at hospital. The Halfway Tree police are investigating. Vaccination Blitz set for National Arena on Saturday. The first coronavirus COVID-19 vaccination blitz, mainly targeting persons 75 years and older, is set for Saturday, March 27 at the National Arena in St. Andrew via appointment scheduling. This was announced by Minister of Health and Wellness, Dr. Christopher Tufton, who said the exercise is aimed at inoculating approximately 1,000 persons. This is the Blitz Center approach, where we put together a much larger infrastructure of medical personnel, where our mobilization efforts are a lot more significant, he said, while addressing the weekly virtual COVID-19 Conversations press briefing on Tuesday. Tufton advised that persons wishing to participate in the Blitz program must make an opportunity by registering online through the vaccination appointment system on the ministry's website www.moh.gov.jm or calling the Vaccination Call Center hotline 888-1-LOVE, that's 888-663-5683. The minister emphasized that making an appointment is crucial, as this will ensure the process is carried out efficiently. He noted that persons turning up to vaccination centers without an appointment proves very challenging for the healthcare professionals, who are then pressed to simultaneously manage individuals who have registered and those who are not. It then involves a process of vetting because we try not to turn away persons if they qualify for the period of vaccination. But it is not an ideal scenario, not ideal for the persons turning up without appointments, because they have to deal with standing up in the sun and persons may start feeling sick and you end up having to provide care for them, he noted. Tufton pointed out that while the population's enthusiasm to be vaccinated can be appreciated, it creates some amount of challenges and, in some instances, confusion, and we would like to discourage it. We encourage you to use the appointment system or wait your turn to be vaccinated. We have to do it in an orderly way, otherwise chaos becomes counterproductive and inefficient, and we would rather not have that, he said. Tufton further informed that the other Blitz sites will be operational in due course, including the Montego Bay Conventional Center in St. James and the Bala Principal Hotel in St. Anne. We intend to begin rolling out these Blitz centers, which is the third phase of the third phase approach, with hopefully another phase to come involving the private sector, he said. Persons with an appointment will be allowed to visit the vaccination sites for inoculation during the recently announced expanded curfew period, which begins at midday on Saturday, March 27. No proof missing vaccine vial was stolen. The much-anticipated audit to determine what became of the one vial of COVID-19 vaccine, which recently went missing at the Cornwall Regional Hospital in Montego Bay, St. James, has found no evidence of corruption or misconduct. A report by Dorian Thompson, the senior internal auditor at the Western Regional Health Authority, however, cited gaps in the internal controls, which led to a vial of 10 doses of the AstraZeneca vaccine not being accounted for. It was also difficult to conclude whether the vial may have been used and inadvertently discharged. The figures presented for the total number of patients vaccinated were analyzed, but it was difficult to conclude on the total number of vials used to vaccinate these patients, the report stated. This was because the number of doses that could be drawn from a vial is inconsistent, ranging from 9 to 11 doses, and there was no record to confirm the amount drawn from each vial. The audit has recommended an overhaul in the oversight of the vaccination project to address gaps in established operating procedures as well as internal control deficiencies. On March 8, Jamaica received its first 50,000 doses of vaccines donated by the Government of India, and on Monday, March 15, received 14,400 doses under the COVAX facility. The country started administering the vaccine on March 10, exactly 1 year after the first case of the virus was confirmed in Jamaica. Jamaica sending more COVID samples for virus variant testing. The government will be sending another batch of positive COVID-19 samples to the Trinidad and Tobago-based Caribbean Public Health Agency this week to test for other variants of the virus, including the Brazilian and the South African strains. Health and Wellness Minister Dr. Christopher Tufton confirmed on March 8 that the highly contagious United Kingdom variant was detected in Jamaica based on the results of the testing of 7 of 8 samples by CARFA. Those samples were randomly taken from the parishes of St. Catherine, St. James, Clarendon, Trelawney, Kingston, and St. Andrew. During a press briefing this morning, Chief Medical Officer Dr. Jacqueline Bisosa Mackenzie noted that CARFA will be testing for emerging variants as well. Mackenzie confirmed that some persons previously diagnosed with the virus have since been reinfected, a matter that is being probed. We've had 1 or 2 cases that appear to be reinfections and those are being investigated. We had indicated before that the possibility of the UK strain being in the country could lead to persons being infected again with another strain, she said. Dr. Javon Winter, a medical practitioner at the University Hospital of the West Indies, said recently he got COVID-19 twice while working on the front line. The health practitioner said he tested positive in September 2020 and a second time 6 months later. He noted that a few of his colleagues have also been infected twice. As frontline workers continue to fight to provide care to those with the virus, the health minister revealed that 180 nurses are currently infected or under quarantine. Jamaica reported 335 new COVID cases on Monday and an additional 6 deaths. A total of 36,231 cases have now been recorded, with 18,947 currently active. Mackenzie noted that a disregard of the COVID-19 protocols is contributing to the rise increasing in infections. Many Jamaicans have not been wearing their masks properly, thereby exposing themselves to further risk, she noted. Our observational studies are showing that 0 to 51% of persons are not wearing masks at any particular time in different parts of the island, she noted. She also indicated that preliminary data from a labor force survey conducted in January 2021 by the Statistical Institute of Jamaica highlighted that 1 in 4 persons are still attending public gatherings, for example, parties. Government allocates $126 million for vulnerable Jamaicans amid COVID lockdown. The government has allocated $126 million to be disbursed to vulnerable Jamaicans amid the impending weekend lockdowns. Finance Minister Dr. Nigel Clark announced in Parliament on Tuesday that each constituency will receive $2 million. The money will be disbursed through the Constituency Development Fund on April 1. These uncertainties increase the risk in the budgeting and fiscal forecasting process, Clark stated as he explained that the government has had to be flexible in managing the COVID-19 pandemic. Prime Minister Andrew Holness on Sunday announced that the country was now at a breakpoint as COVID-19 cases and deaths continue to soar. As part of the containment measures, there will be 3 weekends of lockdown. Saturday, March 27, the curfew will begin at 12 noon and continue until March 29 at 5 a.m. April 1, Holy Thursday, the curfew will begin at 8 p.m. and continue until Monday, April 6 at 5 a.m. Saturday, April 10, the curfew will begin at noon and will continue until Monday, April 12 at 5 a.m. Please remember to subscribe, like, share, and click the notification bell for daily updates.